Hello everyone, our mini talk today is Exercise is Medicine. We are going to be discussing why exercise is considered medicine, the benefits of engaging in regular exercise, and general exercise guidelines. Let's compare a medication prescription to an exercise prescription. Over here we have a medication label for Jane Doe. It's really important to note that your medication is individualized for you and your condition, similar to how our exercise prescriptions are. Your exercise therapist will prescribe exercise based on your medical background, your preferences, and your goals. The type of medication can be blood pressure control, water pills, antibiotics. When we think of exercise, this can be walking, cycling, jogging, resistance training. The next thing I'll talk about is dosage. So Jane is taking 20 milligrams. When we think of exercise, this can be the duration. So for example, walking for 30 minutes. We also have to specify frequency. So in this example, Jane is taking this once a day. When we think of exercise, we can think of 5 days per week. Lastly, let's talk about the considerations. Over here, it says, do not eat grapefruit. Some considerations with other medications may be taking it with food or eating it at night. When we think of exercise, some examples of considerations would be avoiding hottest parts of the day or monitoring for symptoms, dressing appropriately, or any adjustments for musculoskeletal concerns. Lastly, it's really important to note that your prescriptions will change over time. Let's speak about the benefits of regular exercise. The first benefit would be to our cardiovascular system. Exercise reduces the risk of developing cardiovascular disease. It improves blood pressure values and improves cholesterol and triglyceride levels. It also improves general fitness, making activities of daily living easier, and allows you to engage in hobbies and activities that you enjoy. The next benefit would be to diabetes. It improves blood sugar control and insulin sensitivity. It also reduces the risk of developing type 2 diabetes. We also have a benefit to our cognitive function. It improves blood flow to the brain and stimulates the growth of new blood vessels and nerve networks within the brain. It also improves memory, thinking skills, and ability to focus. Another benefit would be to our mental health. It improves mood and emotional control and acts as an effective stress management tool. It reduces the risk of developing anxiety, depression, and other mood disorders. The next benefit would be to our weight and waist circumference. Exercise helps you achieve and maintain a healthy body weight and waist circumference. It also benefits our bone health. It improves bone health and strength and slows the rate of bone loss. Other benefits that we can include is improving sleep patterns and the quality of our sleep as well. All physical activity is beneficial. This may include daily activities such as walking the dog, vacuuming, or gardening. The most beneficial activity for heart health is moderate to vigorous exercise for bouts of 10 minutes or more. In the program, we like to follow certain guidelines. First guideline would be aerobic exercise. We strive for 150 to 300 minutes of moderate to vigorous aerobic exercise per week. The next guideline would be resistance training. This would be at least 2 days of resistance training per week. And lastly, we recommend balance training for all adults. Let's test our knowledge. The question on the screen says, based on the activity guidelines, how much exercise should you aim to complete? A, 150 to 300 minutes of moderate to vigorous aerobic exercise per week. B, 30 minutes of vigorous aerobic exercise per day. C, 2 to 4 days of resistance training per week. D, 5 kilometers of a brisk walk daily. E, A and C. F, B and C. The answer is both A and C. For more information, speak with your exercise therapist. You can always visit our website at gethearthealthy.ca and view our calendar of live events on our website.